Welcome to the Menopause Hour, your go-to source for empowering answers to your burning menopause questions, the ones you won't get from your OBGYN. Brought to you by Winona, menopause care made easy, and hosted by our experts, CMO Dr. Michael Green and Medical Director Dr. Kat Brown.
Hello, everyone, and welcome to another one of our Winona Live Q&As with our Winona doctors. As you can see, we have a couple of our amazing Winona doctors here with us today. So I'm really excited for everyone kind of to be able to get to know them. If they don't already know them, they're a great part of our team here at Winona. And excited to get into some of the questions that you might have. If you haven't been here before, first of all, we're so glad that you've come to one of our live Q&As. You can go ahead and start putting your questions down in the chat, and then we'll jump into those in just a minute. It usually fills up pretty quick, so I would recommend going ahead and running there now, putting anything that might have been on your head or on your brain over like the last little bit in there, so we can jump into that. And then just wanted to also point your attention that if you didn't know, Winona also has recently started a podcast, which is super exciting. It's called The Menopause Hour, and you can get it on Spotify. And it features also the two doctors here with us, which is super exciting. So if you've ever you want to listen to more questions kind of that you have be dived into, that's a great place also on your way to work, on your workouts, a great place to tune in there as well. But if you're here with us today, that's super exciting because it means you're live, you're here. I feel like questions kind of in the moment are always really great ones as well, because we can do follow-up. We can talk a little about the nuances, everything that goes into that. But I will pass it off as well to the doctors to go ahead and introduce themselves. And I think that they have a little bit of stuff to chat about, and then we'll get into the questions. So Dr. Green, I'll pass it off to you first.
So hi, my name is Mike Green. I'm the Chief Medical Officer of Winona. I started my career in family practice thinking that's what I wanted to do, and then fell in love with women's health. So I did a whole second residency to become OBGYN, which I did full-scale OBGYN for about 17 years, then worked as OB hospitalist, and then my little side gig of this thing called Winona turned into my life. So we're so excited to be here. But it's been just a thrill to be able to take care of you. And, you know, we consider education to be really, really important. I think it's so important for you to understand what's going on with your body, what's going on with the medications that you're using, why we're choosing those, you know, all that stuff. And the better informed you are, the better choices you can make for your own healthcare journey, which is super important. So that's what this is all about. To try to help answer your questions and, you know, make sure that you understand everything that's going on. Then I will pass it off to Dr. Kat.
Thank you. And I'm Dr. Kat Brown. I'm the medical director at Winona. I was the first doctor that Dr. Green hired after himself. But I'm a board certified OBGYN as well. I'm located in the greater Philadelphia area. And this is just something that I love to do, is to take care of women and to really help them throughout their entire lifespan. But now that I myself am perimenopausal and going through this and experiencing everything that my patients are experiencing, I can also really, you know, empathize and sympathize with what you're going through, because I'm going through it as well. I'm also on HRT, and it's changed my life for the better. So I think that it's something I definitely want to make sure that more women have access to and have it readily available. And also, we're glad you came out tonight, because I firmly believe that knowledge is power. So, you know, as much as you can, learn about yourself, about your body, about how it works best. You know, empower yourself, because we know that when women learn more about healthcare, they actually take better care of not only themselves, but also everyone else in their family. It's like this positive ripple effect in families and across the country when women really take the reins. So that's something that we really feel strongly about. And at Winona, we really want to educate you as well as provide your medical care. So that's something that we feel is really important. And something else, usually each month we have a topic, you know, to kind of chat about as you're starting to get your questions in the chat. And I took it upon myself, you know, one day to just go through and see, all these special themes that each month have, and if there's any health related ones. And April actually has a special, designation as being Move More Month, which I thought was interesting. I hadn't heard that. We have like cardiovascular disease month, and we have breast cancer awareness month, but April being Move More Month, I think is really important. As the weather is starting to clear in many areas and we're starting to get outside more, it's so important, especially in perimenopause and menopause and just as aging as women, that we really take the time to move our body and to find a form of movement and exercise that really brings us joy and like lifts us up, because that really helps with maintaining our vitality and our health as we age and as we, go through this transition. It really is really helpful. So I thought that would be interesting to talk about. And so if you're someone who doesn't really have a regimen, an exercise regimen, it's time to find something that you really, truly enjoy. And not everyone's definition of exercise has to be the same. Dr. Green loves going to the gym. He and his wife go to the gym. I'm more of a let me get outside, go hiking, be in my garden. I'll do like 1,000,000 squats in the garden as I'm doing work in the garden. But I'm not really a big fan of being in the gym 24/7. But my husband's a gym rat. So there's all kinds of different strokes for different folks, but it's the most important thing is that you find something that's meaningful to you and that makes your body feel good, and keep doing it as much as possible. Because the more you move, the stronger you'll be, the healthier you'll stay over time as well. So I don't know if you want to add to that, Mike.
I would just say, I think when people ask me what's the best kind of exercise I should do, and the answer is the best kind of exercise you should do is the kind of exercise you will do. You need to find something that you like. And like you said, it's different for everybody. And you might have to try a few things until you're like, hey, I really like this. It's kind of nice. I remember, I was always, my wife was doing yoga and stuff like that. She's always been in great shape. I always wanted her to be my gym partner, and she finally tried it. She goes, "Oh, I really like this. I'm surprised." And we've been going to the gym together ever since. So, try different things out. Find something that you like that you'll stick with. You don't have to do it perfectly, but if you do it regularly, that's the most important thing.
Exactly. And some of you might notice I'm in scrubs, so I'm actually at the hospital. So just to give you a disclaimer, if I get a phone call and I need to go run and do something emergently, I will come back if I can, but you'll be in the capable hands of Maddie and Dr. Green if I do have to run. But just to let you know, that might be a possibility.
I love it. I feel like that's a fun aspect. It's, seeing our doctors in action. That's so great.
There we go.
There you go. Well, that's I love hearing a little bit kind of about what, the thing of this month is, and kind of how we can lean into that as well. And I know we have a few questions to kind of jump into as well. And one of our first ones is from Jill Johnson. And Jill is wondering, is everyone's estrogen dose different, and how do you determine that?
Mm-hmm. So typically, we take several different things into account, but we have a nice algorithm that Dr. Green came up with to kind of help us to know where to start somebody. And it is individualized, to your age and kind of your symptom profile. We have our best guess as to where to start a patient based on those things, but then sometimes we might need to make adjustments, and based on how your symptoms respond, we might need to adjust fire and change the dosage here or there. But not everyone is started on the same dose now.
I'll tell a funny story about that, because it's true, although there's only so many doses. And I've had people, they go on the Facebook group and well, these people are all on the same dose as me. You said it was individualized. Well, it is, but there's only so many choices, and there's a lot of women out there. And then I had someone get all mad at me because somebody was on something. You gave someone on the Facebook group something you didn't give me. I'm like, well, yeah, because it's individualized. So it's funny how people get funny about that, but it is individualized. But then again, there's only so many choices. So if you ask around, there will be people that are on a similar or the same thing as you.
Mm-hmm.
Absolutely. And we have a question from Lillian Hearn. And Lillian's wondering, why is my anxiety and depression worse right before my period?
Well, the simple answer to that is that there's a lot of hormonal changes that are occurring right before your period. And so there's a lot of shifts, and the way that happens so quickly, and the way that the female hormones are erratic throughout the month, but specifically that week before, is really why many women get those symptoms leading up to their period. And sometimes it can be extreme. We talk about PMS as one aspect of things before periods, but sometimes there can be even severe changes where we call it PMDD, which is a premenstrual dysphoric disorder, which is actually like a clinical diagnosis. I mean, it can be pretty severe for some patients, but you're not alone. It's very, very common. And so a lot of women experience this.
It's interesting that the same mechanism that causes that is part of why women experience so many symptoms during the menopause transition. Because the ovaries, as they become less and less efficient, are still trying to get hormone out, but they kind of get it out in spurts. So it really makes the levels, not so stable and kind of up and down. And that's one of the ways HRT helps, is it helps stabilize and give you a nice steady amount of hormone throughout the month, which is why it's best to use HRT every day rather than cyclically. But the body doesn't like change, especially hormones jumping all around. And so that's the mechanism that's causing those symptoms before your period, but it's the same mechanism, at least for some of the symptoms of the menopause transition, that cause that.
And we have a question from Amy next. And Amy says, hello from Virginia. She says, I have thin, fine hair. Do I need to worry about hair loss while on the cream and DHEA?
Well, typically with aging and going through perimenopause and menopause, thinning of the hair is something we see pretty commonly. If you're starting out with fine hair, there's a possibility as your hormones are adjusting that you might notice some change in the sequence of when you're shedding hair and when it's regrowing, and that can be a natural phenomenon. But for most women, when they start adding estrogen into the equation, it usually helps with the appearance of skin and hair and nails over time. So most women see a positive, effect on their hair from the medication, especially the estrogen.
That's one of those that takes a long time, though, because the hair cycles are so long. It's a 3 to 6 month cycle. So, by the time it kind of starts cycling around and improving, it can be a while. So some of the symptoms get better pretty quickly, but hair changes tend to take a while. So you got to hang in there to get that benefit.
Yeah. And we have a question next from Aisha, and she's wondering what options are available for breast cancer survivors outside of testosterone?
Well, so really, if you're a breast cancer survivor and you need an enhanced level of surveillance, it's really best for you not to get HRT via telemedicine, like a service like ours. Really, because of your history and because of your increased risk of recurrence, and especially if you had a breast cancer that was receptive to hormones, it really is best for you to be served and cared for by an in-person provider who can more appropriately monitor and examine you and just keep that surveillance. So there are options out there, but most doctors are going to want to stay away from giving you hormones if you've had a breast cancer history. So they might want to explore other options.
And we have a question next from Angela, also about testosterone, but she's wondering, is testosterone recommended for every woman? How do I know if I should start it?
Well, so the really quick answer is that, in the United States, testosterone is really not approved or recommended for women. However, we in this specialty, taking care of women know that, women have testosterone just as much as men and can respond positively to it. However, testosterone can be widely abused and misused, and so it's considered like a controlled substance. So we don't specifically prescribe testosterone on our platform. We use another medication that's a precursor hormone supplement to help gently raise your testosterone levels, and that's something called DHEA. And so that's something that we offer to patients. It's an optional addition to your HRT, but that's how we can help you gently raise your testosterone levels.
Testosterone's a really tricky medication for women. It has what's called a narrow therapeutic window, which means that the difference between the amount that makes you, that treats your symptoms and the amount that gives you side effects is really thin ice. So it's hard to hit. And so for men, because their testosterone is so much greater, there's a lot bigger leeway, and so it's a lot harder to sort of hurt somebody. But it's really easy to overshoot testosterone and cause really bad side effects, and some of them can even be permanent. So that's why, besides the fact that it's a controlled substance, it's something that really needs to be monitored very closely. Mm-hmm. That's the nice thing about DHEA. In the doses that we prescribe, it's enough to get you into a normal female range, but not enough to push you beyond that. So it's just a much safer way of doing it. And, it's gentle, but it does work. Then it will raise your levels. It's not going to turn you into a professional bodybuilder. So if that's what you're after, there's other ways to do that, but that's not something that we do here. But it won't also do that by mistake, which is what I think most people are worried about.
And we have a question next from Nicole. And Nicole's wondering, how long does it take for the HRT to work?
So sometimes for some women, they can get relief from some of the vasomotor symptoms like hot flashes and night sweats the soonest. But some of the other benefits, like, Dr. Green mentioned earlier about the changes in hair, those things can happen later on. So the other thing too is that for hormonally related weight gain, seeing a benefit of some weight loss also is one of the later benefits of starting HRT. Most often it's the hot flashes and night sweats that respond early. Then also sleep will get improved as well as you get the dosage, well established in your body. And then the brain fog typically starts to improve. But every woman's pattern and how their symptoms respond is kind of on a different cycle, and every woman may respond differently. But we do know that some of those later benefits, for most women, we have to tell them to stick in there, because our human nature is that we want instant gratification and we want to feel better like yesterday. So, I often get messages from patients saying, well, I started the medication last week. Why am I not feeling that all my symptoms are improved? And you really have to give it time. It takes time to establish the medication in your system, for your body to welcome the medication and get the dose, steady in your system before you start to see the benefits and to see that pendulum swing the other way.
And our next question is, my mother had breast cancer. Should I be concerned about using HRT? She says my breast exams have always been fine.
So if you have a family history of breast cancer, that doesn't mean that you're not a good candidate for HRT. Now, the caveat with that, though, is that if you had a first-degree relative that, had breast cancer and tested positive for a genetic syndrome that can cause the breast cancer, that makes you a bit higher risk for breast cancer than the average population. So that would be the only reason that, we might not want to prescribe for you if you have like one of the BRCA genes. But just a family history doesn't, preclude you or disqualify you from getting treatment.
And we have a question next from Laura. And Laura says, have you heard of TMJ or jaw issues related to menopause?
Yeah, the joints everywhere in the body can be affected by the loss of estrogen. It's amazing when you think about how many different receptors throughout the body, are really need estrogen to function optimally. And when you remove that estrogen and those levels are declining, the joints can respond. And sometimes for some women that might, equate to, arthritis or joint pain, stiffness. But sometimes it can happen, it can be related to the joints. And the TMJ is, for other patients listening, might be, that aren't familiar with that term, it's temporomandibular joint. It's this joint here, where your mandible joins, and it's like our chewing joint, basically. So you can get clicking and, stiffness and pain, which can then lead to like tension going up and causing headaches. I have had patients complain of that, and it certainly can be a possibility, but every woman's experience of symptoms is unique, and every woman will have a different constellation of symptoms. That's what makes it so difficult to recognize and to treat. And, and I think for women themselves to even recognize what's going on, because these symptoms start to creep in and you wonder, like, what's happening? Am I falling apart? Like, what's going on?
The other thing is that TMJ can be exacerbated by stress and anxiety.
Yes.
Especially if you're, a tooth grinder, in your sleep, as a way that you express your stress and anxiety and that kind of thing. And so HRT can help reduce anxiety and some stress levels that you start feeling better. And that can also kind of secondarily help your TMJ as well. So there are, direct and indirect ways that HRT may be able to help with that.
Absolutely. And we have a question next from Jen. And Jen is wondering, what kind of hormone is in the pills? Is it plant-based bioidentical, or what is it?
Yeah, so if you're talking about the pill form, we have estrogen and progesterone pills. Typically our HRT and those hormones are plant derived, and they are bioidentical, meaning that they are identical chemically in their structure to the hormones, the same hormones that your body would be creating on its own. And the same thing, with the DHEA as well. DHEA is a hormone that our body, produces on its own.
We have a question from Odetta next. She says, I'm 55 years old, and would like to know the difference between HRT and BHRT. I'm considering taking one of them, and I'm wondering if I'm too old to start now.
So it's kind of nomenclature. So I guess all BHRT is HRT, but not all HRT is BHRT. So the B is the bioidentical. So there are forms of HRT that are synthetic. The drug companies like to call them biosimilar, like they're almost bioidentical, not quite, but they're. But BHRT generally means that it's bioidentical HRT. And honestly, I'm lazy, so I just write HRT. But I guess I should distinguish maybe. But what we use is always BHRT. It's what we use at Winona is bioidentical. But that's the difference between that. 55 is not too late to start necessarily. The general rule of thumb is that as long as you start before 60, you get all the benefits, including the long-term health benefits. The exception would be if you're more than 10 years since completing menopause. So, that's a possibility, although if you're having symptoms, it's probably unlikely unless you had surgical menopause a long time ago. But 55 is actually not too late, and you still have a lot of ability to get and a lot of time to get benefit out of this.
And we have a question next from Heidi, and Heidi is wondering, do I need to monitor things like blood pressure, cholesterol, or hormone levels regularly?
Well, you should be getting monitored for your blood pressure and your cholesterol levels just as a part of your preventive health care, getting a yearly physical and having a primary care physician. But hormone levels are not necessary to follow. However, the only hormone you should get checked as a woman is your thyroid periodically. When you get your annual labs to check your kidney function and your blood count, that should be something they screen for periodically as well. But your female hormone levels like estrogen and FSH and progesterone, they're useless to us for really treating you. It doesn't help us to take better care of you. This is something that, menopause and hormone therapy is best treated based on symptoms. And any menopause specialist who knows how to take care of patients and cares for them well will practice that way. Even our national governing bodies that give us guidelines to help treat patients, like the American College of OBGYN and the National Menopause Society, they recommend against the routine lab screening. However, someone out there will try to take your money and get you to do lab tests, or they might get you to do a salivary test or urine hormone testing. It really is not useful to us to take good care of you, so you don't need to do that. Save your money.
Well said. I always say, just because we're taking care of your hormones doesn't mean that you don't need to take care of everything else. So you still need to go see your doctor every year. It's really important. My grandfather, when I learned to drive, if you don't take care of your car won't take care of you. He used to hammer that, you got to get your oil change and all that. And that's the same thing with your body. If you don't take care of your body won't take care of you. So you still got to get your routine health maintenance. That's super important. Can't emphasize that enough. But hormone tests, not useful. They're useful at emptying your wallet, but apart from that, they're not very helpful.
Our next question is, what are the bioidentical hormones in the products derived from, and what makes them bioidentical?
Well, we answered that a little bit earlier, when we explained that bioidentical just means that it's identical structurally to the hormones that your body creates on its own. Initially we used to say that most of our hormones were derived from yams, but then there was like a worldwide yam shortage. So we were still using a plant-based source to help derive the hormones. So, that's something that, we stand by, but not always yams.
Yeah, it's kind of interesting. We first started 4 years ago. Actually, that's what we should have talked about. April, this is our four-year anniversary.
Oh, yeah. Well, you can talk about it now. Yeah.
I just realized that. That's what we should have opened with. Anyway, happy birthday to us, right? But when we first started out, like it was all yam based. There's a special kind of, it sounds crazy, like, come on, there's yams all over the grocery store, but it's a special kind of yam that they get these from. And then as bioidentical hormones became, more popular and more sought after, they couldn't keep up. And so there are other, root vegetables that they get these from, similar. But so we don't want to mislead people, so we can't promise that they're actually coming from yams, maybe from a different vegetable, but they're all coming from plant sources. But yeah, 4 years, kind of cool. I still have a few patients from the old days. It's kind of neat when they message in. It's kind of exciting.
Yeah.
Great. Our next question is from Nicole. And Nicole is asking, how does the cream work and why do they say your anxiety may get worse when beginning?
Well, how does the cream work is basically, the hormones are embedded in the cream. And so when you're applying the cream on your skin and rubbing it in, the hormones are actually absorbed directly through the skin into your bloodstream. And then they're circulated in your bloodstream to the tissues that are intended to receive them. So that's how the medicine gets in your body. Whereas when you take a pill, you have to swallow the pill. It gets broken down by your stomach, gets filtered by the liver, and then gets into the bloodstream to get to the other tissues. And so that's basically how the cream works, is it just gets absorbed through the skin. Now, sometimes, whenever you have sudden changes in your hormone levels, like we were talking about in the beginning of the call about PMS and changes before the period, anytime you have a big swing in hormones, your mood can respond. The body doesn't like the sharp swings. And so when you first start treatment, sometimes your symptoms might feel a little bit worse. Your mood might be a little bit off. You might be a little bit, short-tempered or whatever. Everyone can respond a little bit differently, but that's mainly due to the change in that hormonal environment. And it will get better the more you continue to acclimate to the medications.
It takes about 3 weeks to achieve a good steady state. And that's one of the bummers, honestly, is, we talked about how it takes a while for the symptoms to go away and get better. And so it's like, wow, you take this new thing, you're all excited, and all you get is side effects for 3 weeks. And it's a bummer. I wish we could design it differently. The good news is you get past that part where you get that steady state and those go away, and then you start reaping the rewards. So it is kind of a delayed satisfaction on that, but that's what's going on. By the way, I know you didn't mean this, but you don't actually get the medicine into your blood system by like rubbing the
well,
yeah.
Yeah.
No, I know. But I'm worried someone's going to imagine, I got to really rub it in.
No, yeah, it gets absorbed by the little fine vessels in the skin. Yeah.
So it's just, you apply it and you can just, do that.
Yeah, don't cut your skin open trying to rub it in vigorously.
Well, it's kind of interesting. When we do surgery, there's a whole scrubbing technique of the hands. And there was a study, it turns out this whole like doing this and all that doesn't do anything different than just putting it on and sitting there. The difference is that this distracts you, so you leave the medicine on your hands to kill the bacteria longer if you actually distract yourself by scrubbing and stuff. But when I started out, everybody was using these like kind of harsh scrub brushes. It's like, you're not killing bacteria by scrubbing them, but that was kind of the thing. And now we have different techniques for the most part, but it's kind of the same idea. It just kind of reminded me of that. It's kind of a funny thing. It's like, yeah, no, you can't really kill bacteria by squashing them.
We have another question from Crystal. And Crystal is wondering, she says, can you share more on shrinking and vaginal atrophy? What helps?
Well, so basically, what happens is we get these age-related changes in the vaginal tissue. So when we're young and healthy and in the prime of our lives as women, we have normal folds, which are called rugations in the vagina. The vaginal tissue or mucosa is thick and it's more elastic, more supple, more moisturized. And when those tissues lose estrogen, the tissue becomes thinner. We lose that elasticity and the stretchability of the vagina. So those folds or rugations go away. And honestly, if you don't use it, you'll lose it. So if you are not actually, having penetrative intercourse, if nothing's going in the vagina to keep it stretched and exercised, and you're not supplementing with estrogen, what can happen over time is the vagina can get more narrow. And then when you do try to introduce something like, say, for us as a gynecologist, if we go to examine a patient who hasn't had sex in many years or hasn't been using estrogen, simply putting a speculum in can be extraordinarily painful, can actually cause tearing of the skin. And that can happen for women when they go to try to be sexually active after they've not had estrogen in their system or not had anything in the vagina for a long period of time. So, that's why people say it shrinks. It's just that the tissue actually, is getting more firm, less elastic, less moisturized over time too. So that's basically to explain what happens there. So
fortunately, it's pretty easy to treat
yes.
with estrogen. We have an estrogen vaginal cream that works extremely well for that. It's interesting. I was around when Viagra came out, and there was this huge sort of thing that people didn't talk about, where these older couples were coming in, and all of a sudden they'd had a marriage for a long time that was working without intercourse, and now the husband was potent again, and they hadn't used it for so long that the lady, was having pain and problems. And so we had to kind of slow things down, get her on some estrogen cream, get her vagina back into good health so that they could both enjoy the Viagra from both sides. It was just kind of an interesting problem. I didn't really see much talk about it, but I saw a lot of it in my office at the time.
Mm-hmm. And our next question comes from Nicole. And Nicole is wondering, she says, does HRT really help with the excess weight that I have gained, because it's like horrible?
Well, so, weight gain can be from a variety of reasons. I mean, there's a lot of things that change as we get older. One of the aging things that can happen too is that our metabolism is changing, but also when your hormones are fluctuating and you're losing estrogen, you're also in this high stress state too. So you're not sleeping as well. You're dealing with night sweats and hot flashes, and your body is not getting, the rest and, rejuvenation that it needs each day. So that cortisol, high stress level, can also cause you to hold on to weight. And a lot of, women start to experience weight gain, especially in the middle of their torso, the infamous menobelly, we talk about, and feeling more full in the abdomen when you maybe never dealt with that before. And it's very, very common for women to accumulate weight there. So typically, for the hormonal relation to weight gain, starting HRT should help that, but not in isolation. Like, you still need to eat well. You still need to think about your nutrition. You still need to move your body. Like we talked about at the top of the call, like move more a month. So it's very important that you have a total, wellness picture in your body. So like just taking a medication is not the only answer. You need to make positive changes to help improve, your strength. We also lose muscle mass as women as we age. And so it's really important to maintain your muscle health and fitness and do some weight resistance, resistance exercises to keep those muscles healthy. Because if you lose muscle mass, and you don't have as much muscle, your metabolism really, really slows down. And so, you're replacing muscle with fat, and you're not really, able to metabolize your meals. It doesn't matter how little you eat, you're still not going to burn the calories that you take in. And so that's something to consider too, but it should help for many women.
It's interesting. It's kind of like, you get these charitable organizations where somebody has promised to match funds. And so that's kind of how HRT is with exercise and diet. It's like exercise and diet help, and then HRT is like matching funds. So it helps even more, but you still have to get the original funds to get the matching funds. So
I like that idea.
It'll give you, more benefit for what you were normally doing, but you have to still do the right things. So it's not a magic pill, but it does help. And as we were saying earlier, that unfortunately, that's one of the ones that takes a while before you really see the benefits.
And we have a question from Laura next. And Laura says, I read on the website that patients can be reevaluated every 10 weeks to determine if adjustment in treatment is needed. Can this be done sooner, and what would this entail?
So you can message us on the portal, on the platform, anytime you want. Now, generally, when someone's first starting HRT, we don't really like to make wholesale changes in those first few weeks, especially, or even in the first 2 months, because it really takes time for your body to acclimate to the dose. But, after that first 10-week period, really we want to reevaluate to kind of see, like, are all your symptoms improved? Is there still room for improvement? Is there something that's, particularly bothersome that you want us to address more? And we can make changes based on what symptoms are still bothering you. But if you've been on meds for a year and then all of a sudden you start to have symptoms creep back, you can message us anytime. And we could always discuss if we need to make changes. And so, I caution patients from making changes too early or too quickly, especially if you've only had an onset of new symptoms. Hold on a second. I'm going to go on mute and let you finish, okay?
Okay. I hope someone's not ready to have a baby. When I designed this thing, I designed it like I do in my office. So if you were to come into my office and I was going to start you on HRT, I would start you on the dose and I would bring you back in about 3 months. And we discuss and see how it was going. And then if everything was good, I'd give you a year's worth of refills and I'd see you back every year. And so that's what we do at Winona. It's really the same thing. And so the interesting thing is, I originally thought 10 weeks was going to be the sweet spot, but 10 weeks was a little bit early. So you actually get your follow-up at 11 weeks. It's about a week before that 3-month refill is due, and it gives us enough time to kind of go back and forth if we need to adjust it. But that 10-week nomenclature, the naming of the 10-week just stuck. So we all still call it a 10-week follow-up, even though we changed it to 11 weeks. But that's kind of small potatoes. But so you don't necessarily get a follow-up every 10 weeks. You get that first follow-up in 10 weeks. And then generally we reach out to you every year, or 10 weeks and then every year is the general pattern. But you can reach out to us at any time. Occasionally I've had patients upset because I didn't reach out to them. And so I tell them the same thing I tell my mom, and she gets mad about that. I say the phone works both ways. So you can always reach out to us anytime, and we're very happy to answer your questions or debug stuff. But as Dr. Kat was saying, if you make changes too early on, as we were saying, the body doesn't like changes. So it takes a while after you make that change to get the benefit of that change. So if you're just constantly changing, you're never going to get to that steady state, that sweet spot where you're getting the benefit without the side effects. So that's one of the big reasons why we like to try and kind of get you through that first few months to see where your body's going to be once you get into that steady state.
And we have a question next from Lisa, who's tuning in on our Facebook stream. And Lisa's wondering, should you still take progesterone even if you don't have a uterus?
Almost always no. There's a few exceptions. There's always an exception that makes the rule. But in general, the real benefit of progesterone is to protect the uterine lining from estrogen. So estrogen is great. Estrogen receptor is in almost every cell in the body. And for the most part, estrogen is beneficial almost everywhere. The one exception is that it can overstimulate the lining of the uterus, and if left unchecked, that can cause problems. And so the progesterone is added to help balance that estrogen and keep the lining of the uterus healthy. That's the most important reason of why we add progesterone. If you've had a hysterectomy, your uterus is sitting in a pathology lab somewhere, and we don't really need to protect it from the estrogen, right? So if you don't have a uterus in your body, then we don't have to worry about that. Progesterone has side effects. It's interesting. This is an answer on the test that most people get wrong, but estrogen does not increase your risk of breast cancer, but progesterone does, not by a lot. But there is a slight increased risk of breast cancer when you take progesterone. Progesterone also can stimulate appetite, and it can work against you in that whole weight loss thing we were just talking about. And so it's not like a freebie. And so there's no point adding a medication that has potential risk and side effects if you're not getting the main benefit out of it. So in general, for most people, if they've had a hysterectomy, we do not recommend progesterone. Now, endometriosis, for example, is an exception because it's really the same mechanism. There can be endometriosis tissues outside of the body, and it's the same idea of overstimulation. So the progesterone helps protect that even if you don't have a uterus. But like I said, there are some exceptions, but for the most part, we do not recommend progesterone if you've had a hysterectomy.
And our next question is from Leslie. And Leslie says she just started treatment a few days ago, but she's wondering if you can use the vaginal cream for burning and itching with the regular estrogen and progesterone cream and DHEA.
Yes. So the big exception to the thing I just said, again, there's always an exception. Vaginal estrogen does not really get absorbed into the circulation in any meaningful way. And so actually that's the one kind of estrogen you can give without having to worry about progesterone. So if you still have a uterus and all you need is vaginal estrogen, you actually don't need progesterone with that. So likewise, because it just works locally on the vaginal tissues, it's safe to use that along with the other medications. It's not going to raise your estrogen levels too high because it's not really getting absorbed. The systemic HRT, the cream or the pill or the patch, will help the vaginal tissues, but it doesn't help as well as the estrogen cream, and it takes longer. So if your vaginal symptoms are sort of subtle or not too bad, the cream or the pill or the patch may be enough. But if it's pretty significant, adding the estrogen vaginal cream is safe and can be really effective for that.
Absolutely. And we have a question from Heather next. And Heather is wondering, how long can a postmenopausal woman stay on HRT?
So the answer is as long as it's helpful. And honestly, some people choose to stay on HRT forever for the cardiovascular benefits. This is really, actually, I was just mentoring a doctor about this. There used to be this mantra for HRT that you should use the lowest dose for the shortest amount of time possible. And in fact, that's still in textbooks because mantras don't go away very easily. But that idea has really been changing. And we've learned that there are these tremendous health benefits to hormone replacement therapy apart from just symptom control. So it really decreases your cardiovascular risk, decreases your risk of osteoporosis, decreases certain cancers. So there are these benefits of HRT that are long lasting and may or may not be a reason to stay on it for a long period of time. But at minimum, as long as it's helping and relieving your symptoms, there's no reason to stop it. That there's this age of 60 thing that confuses people along those lines, and that it's not really safe to start HRT for the first time if you're 60 or over. But if you're on HRT, you can continue it even after you turn 60. There's a logical reason why it's a little complicated, probably more than you guys want to hear, but that is a safe way to use it. It's fine to continue taking it as long as it's helpful, no matter what your age.
And we have a question next from Susan. And Susan is wondering, which is more effective, the estrogen progesterone cream combination or taking the estrogen or having the estrogen patch and the oral progesterone pill?
So they both work great, and neither works better than the other. It depends on what dose you're on, of course, but they all have various doses, so we can adjust the doses needed. It really comes down to personal preference and cost. The patch is put on your skin, you wear it all the time, and you change it twice a week. And some people like the convenience of only having to deal with it twice a week. Whereas the cream you apply to your skin usually each night at bedtime, so it's kind of a once a day thing. On the other hand, some people find it annoying to wear a patch all the time. And if you're one of these people that kind of get rashes easily, especially like from Band-Aids and stuff, the adhesive in the patch can irritate the skin sometimes. It also is supposed to stay on when you swim and in the ocean and that kind of thing. But if if that's your big sport is swimming, it may not be the best thing for you because it can sometimes come off. So there's different things, and it really kind of depends on personal preference. But as far as efficacy, as far as what actually works, they both work great, and one doesn't work better than the other.
And we have a question next from Carrie. And Carrie says, I'm 11 weeks into my HRT cream therapy. She says, I was feeling a lot better, but then suddenly I started feeling a little bit fatigued again and having some achy bones. Any suggestions? What's going on here?
You may need to adjust your dose sometimes. And so the needs of the body change from time to time. And sometimes you can kind of your body can accommodate to a dose, and sometimes you need to push the dose a little bit. Or sometimes it's the other way around, and you're doing great, and all of a sudden you're out of nowhere, you're starting to get some side effects, and it's time to back off a little bit. So it is dynamic. Some women are on the same dose for long periods of time, but it's not uncommon to have to adjust the dose now and then. So it may be that what was working for the last 11 weeks isn't quite hitting it, and we need to goose it a little bit and give you a little bit more. So that's something that you can message into your Winona doctor, and we can help you and make suggestions.
And we have a question next from Nicole. And Nicole says, my doctor put me on 50 milligrams of Zoloft to reduce my perimenopause symptoms. I don't like being on it. Is it better to be on HRT instead?
So in general, in my opinion, yes. There are, for instance, the patient that at the very beginning that with the breast cancer, that would be a great use of Zoloft because it's not going to affect the breast cancer and it will help with some of the symptoms. HRT actually works at the root cause. So not only does it address the symptoms, but it addresses symptoms better and comprehensively because it actually works at the root cause. Whereas Zoloft sort of helps with symptoms by sort of masking the symptoms, which isn't necessarily a bad thing. But I'd rather have a comprehensive treatment that's really working at the underlying cause, and that's what HRT does. Besides that, as I mentioned just a little bit ago, HRT gives you other health benefits that Zoloft isn't, such as decreased risk of cardiovascular disease and osteoporosis and all that stuff. So I think in general, if the Zoloft is only for your symptoms of menopause, then I think most people are going to be better off on HRT.
And we have a question next from Amber. Amber says, when I talked to my regular OBGYN, they refused HRT because they said it would mess up my cycle since my cycle is so regular. How likely is it that I will lose my regular cycle with HRT?
It's very unlikely. For better or for worse, HRT doesn't really change the cycles much, which in your case is good news. But for some people, if their cycles are pretty bad, HRT isn't great at helping those. So that's kind of the one symptom of the menopause transition HRT isn't super great at. But in your case, where you have nice regular cycles, it really shouldn't change those. Now, the caveat to that is that that's assuming that you're using daily HRT. So some people try to cycle HRT, which was an idea that was popular 10 or 15 years ago and has kind of fallen out of favor because it ends up just causing more symptoms, a little bit of havoc with your cycles, can cause spotting and bleeding. So if you're using HRT continuously, where you're taking it every day, it really shouldn't affect your cycles, positive or negatively.
Absolutely. And we have a question from Deborah next. And Deborah's wondering, will this help my energy levels?
Typically, yes. Through various mechanisms. So probably one of the biggest mechanisms is sleep. So one of the big symptoms, the very common symptoms of the menopause transition is people aren't sleeping well. And sometimes it's just they aren't sleeping well. Sometimes it's because they're waking up with hot flashes or they're having to pee all night. And HRT can help that. And then, with the increased sleep benefit, you get a myriad of other benefits as well.
Absolutely. We have a question next from Stacy. And Stacy says, I have joint and muscle pain, which impedes my workouts. I hear this is often a menopause symptom. She says, I've been reading GLP-1s may assist with receptors in joints to help with this pain. Curious about your thoughts on this or what you've heard in the medical community.
So joint and muscle pains, particularly joint pains, are a very common symptom of the menopause transition. On the other hand, there are lots of things that can cause joint pain. So, from my various things I probably shouldn't have done in my youth, my knees sometimes hurt me. And it's not because I'm going through menopause. So, people get joint pain sometimes, but it is a very common symptom of the menopause transition. And so if that's what's driving your joint pain, HRT can help. Even if it's not directly related, estrogen can work as an anti-inflammatory and help even non-hormone related joint pain to some extent. So it is definitely something that can help. The GLP-1s is really interesting. That is another interest of mine. We are learning we're seeing all kinds of anecdotal things with GLP-1s. And I have seen people have improvement in joint and muscle pain. It definitely has an anti-inflammatory effect that, quite honestly, we don't totally understand right now. It's an interesting drug. So you give it to someone for diabetes or weight loss, and all of a sudden, their joint pain's better, their fibromyalgia is better, all these, various things. I can tell you, for me, those who have sort of followed me through Winona for the last 4 years have noticed a big transformation. I've lost 20% of my body weight on a GLP-1. And I, according to my wife, used to snore really badly. Well, I know, because she used to hit me to wake me up to get me to stop snoring. And this cured it. I don't snore anymore. And in fact, I went off for about a month. And she said the snoring came right back. So as soon as I went back on. So there's all these weird things that the GLP-1s help with. I know I totally digress, but you kind of hit an area of my interest. And it does seem to work pretty well as an anti-inflammatory as well. And so you seem to get some joint and muscle benefits. But again, that's anecdotal. I don't know there's any good studies out yet. I haven't seen any, but we are seeing that.
Well, and welcome back, Dr. Kat.
I'm back.
For the last few minutes. We're glad to have you back, for sure.
Was it a boy or a girl?
Oh, it wasn't a delivery. It was another issue, unfortunately.
I'm teasing. So I used to play video games in the call room, and I used to play a game called World of Warcraft. And one time I was playing with a bunch of people online and had to run to do a delivery. And then I came back, and then we were playing some more, and another guy went to get a pizza, and they were giving him a hard time, and it took him longer to go get his pizza than me to deliver a baby.
Nice.
So funny. Oh,
anyway, I digress. See what happens when you leave? They get all these crazy stories.
We have a question next from Christina, and Christina's wondering, is it okay to take HRT while on birth control?
Yes, if you're still of an age where you need to prevent pregnancy and you don't have another way to do so, you should stay on your birth control. We usually recommend women stay on it until they're 50, if it's safe for you to take. But you can start HRT even while you're still on your birth control, because HRT will not prevent against pregnancy. It will not prevent you from ovulating. And that's what you need the birth control for. So, yeah, they can be taken together safely.
It's interesting. This is something that raises eyebrows, and your family doc or your OBGYN may think that's not right or weird. And I'll be honest with you, I was a little surprised how well it worked myself. When we started doing this, we started giving HRT to women on birth control, and I was really pleasantly surprised at how it works really well. It really seems to hit the receptors differently than the synthetic hormones in birth control. And so it's not something that's sort of necessarily widely talked about, I think. And I think a lot of doctors are surprised by that. So you may, when you go see your regular doctor for your annual checkup, may raise some eyebrows. But it is something that's very safe, and it does seem to work.
And we have a question from Maureen next, and she says, you can get DHEA over the counter. So what's the difference between that and getting a prescription of DHEA that we prescribe at Winona?
So the main difference is the quality. So, when you buy a supplement or a vitamin or a mineral, anything over the counter, you don't really know that what you're actually buying and what's on the label is actually what you're getting. Supplements are they're not regulated by the FDA. They're not needing to be, studied or, confirmed for consistency, whereas we at Winona have actually found a supplier that we trust. And we've, independently tested our supply. And so we feel really confident that our quality of our DHEA is superior to what you can buy off the shelf elsewhere. So, but, as a consumer and as a patient, you have the choice, but, that's why we recommend our DHEA over others.
Yeah, I can tell you about a year and a half, maybe it's 2 years now. We rejected a big batch of DHEA because it didn't meet our standards. And it actually caused a little problem for us. We had to send out just 30 at a time until we could, get the next supply in. But, we weren't going to take, we're very, very picky. And we want to make sure that what we're giving you is exactly what what we say it is, and what's in there, and it's pure, and it's good. I think our last order, I think we ordered 10 million units of DHEA. So when you're the manufacturer, my understanding was they actually expanded their manufacturing process for us because when you order that kind of volume, you have a lot of control and a lot of say over the quality and what goes in it. So it's something that we're extremely picky about because it is a supplement, and it's not regulated the same way that other pharmaceuticals are. So we want to be extra careful with it.
Absolutely. And it looks like we have time for one last question. And I did want to just note to everyone who's watching, if you didn't get your question answered this time around, we'll have these live Q&As. We have events like this twice a month. We would love to see you at our next one. As I mentioned at the beginning as well, we have our podcast. It's called the Menopause Hour. You can find it on Spotify. And there are Q&A sessions just like this where you can kind of listen to that on the way to work. You can listen to as you work out. Those are great places to also get some of your questions answered there. And also your Winona doctor is always available 24/7 in your patient portal. So that's a really great place to, all of these questions that you're sending, that's a great place to ask your doctor that as well. They're really there to kind of hear that from you. And they love to answer your questions and kind of help you figure out what next steps you might need to take. But for our last question for tonight is from Mary. And Mary is wondering, is it normal to get your period when you start the cream?
Well, so for some women that if they're starting HRT, for the first time, they can get changes in their bleeding pattern. So if you have already stopped your periods and you're, postmenopausal, it can be normal to have a little bit of spotting as you're starting. Or if you're still getting periods, whether they be regular or not, you can have some changes in your bleeding pattern when you start your HRT. And that can be normal because your body, your uterus is responding to the change in hormonal environment. And usually these changes are temporary.
Let me jump in because while you're out saving a life, I said something that may be confusing because someone asked, she said she had nice regular cycles and her OB-GYN told her not to start HRT because it was going to mess up her cycles. So we're talking about the first month or two. It can cause changes. After that, you should go back to whatever your normal state is. And that's kind of what I was talking kind of long term, is that this really should not affect your cycles. First month or two, all bets are kind of off. But, our rule of thumb is if it's 3 months and you're still having irregular bleeding, that's something that we probably want to look into because it's not what's expected from HRT.
Well, thank you, Dr. Green, and thank you, Dr. Kat, for lending your time tonight. I know that these Q&A sessions are widely loved and appreciated, and I love getting to be on them and hearing your answers as well. So thank you so much for your all's time, and thank you everyone who made time in their schedules also to come out for our live Q&As. We're really glad you're here, and we hope that we'll see you at one of our next events or listening to our podcast or in our Facebook group in WWG. Commenting up a storm, making posts. That's a great place also to find some community as well. But thanks again, doctors, and I hope everyone has a great night.
Yes, have a good night, everyone.
Night. Thanks for coming out.
Thank you for joining the Menopause Hour, brought to you by Winona. Menopause care made easy. To learn more, find Winona at bywinona.com and on Instagram at bywinona. Want to have your questions answered next? Register for our upcoming live Q&A, linked in the show notes.